Come with me today. We are filming my friend Blonde, who is having both PRP and cellular matrix treatment today on her face, around her eyes, PRP, not cellular matrix there, cellular matrix along her face, neck and décolletage. Okay, the intake session has already happened. The information pack was already emailed out to Blonde. She has signed her consent form in advance of the treatment, and we are both happy that she is a suitable candidate in order to have both PRP and cellular matrix treatment done. PRP is suitable for almost everybody. There's a very small minority that is not suitable for. And no different to the blood draw that I did for my husband a few days ago. I will be taking one ampule of blood from Blonde. That's about 10 mils, just one of these. And that can be used anywhere in her face, neck, décolletage. It can be used around the eyes. However, we are doing an extra draw on Blonde today, and we are using cellular matrix as well. Cellular matrix is the one that's got hyluronic acid in it, and that is PRP plus hyluronic acid that we're going to use in her face, neck and décolletage. So depending on how much blood we'll be able to get from Blonde, this would be another 10 mils as well. So if we can get enough blood, we'll give it the full Monty today. As a registered nurse and state certified midwife, I worked in labour wards for a long time. We put up our own drips on our patients in labour, and particularly at times of emergencies. We were taught by the anaesthetist on site. So the reason I'm telling you this is because PRP is 7 mils of your own platelet-rich plasma, so it's your own blood, and I'm more than confident in taking blood from you. Okay, let's do this. All right, 2 ampules of blood. This one is for pure PRP, 10 mils, and it yields about 7 mils of platelet-rich plasma with its growth factors. This is what we're going to use around the eyes, the neck, and the décolletage. This here is a little less in consistency, and this is the one that is cellular matrix. So this has got the hyaluronic acid in it. This is what we're going to use on the cheeks and the areas that need hyaluronic acid in the face. All right, let's do this. All right, so all done. So that is my friend Blonde, who had 2 treatments today in the one visit. So she had PRP in her forehead lines. She had PRP around the eye socket and the side of the orbital area here. She had PRP under her chin, neck and décolletage. She had cellular matrix, which was usually, which includes hyaluronic acid, and that is used usually around this area here, marionette lines, nasolabial folds. So she found the PRP treatment a 0.5 out of 10 from a soreness point of view. She found the cellular matrix a little bit more stingy, maybe a 2 out of 10. Treatment itself took about 15 minutes because we were filming. Aftercare for Blonde is no showering this evening. We want to make sure that any of the escaped platelet-rich plasma that's on her face has got a chance to actually seep back in. Firstly, no swimming pool, no jacuzzi, no sea swimming, no sunbed, no spray tans, no exercise, no gym for 24 hours. And that she'll get little raised bumps around the area that the work was done, but that usually goes down in about 24 hours, far less, to be honest. Any of the raised areas are at treatment time go down in 10 minutes, but with the hyaluronic acid, it attracts 1,000 times its weight in water, so that will kind of give a little bit of a bee sting area around the cheek area, and that will be gone in 24 hours. What else do I have to tell you? There's no guarantees because of the vasculature of our faces that Blonde won't bruise. But if she does, she can use a concealer foundation tomorrow. One of the common questions that people would ask me was, why would you use PRP over the likes of Profilo, Restylane or Bellaterra Revive? Well, the reason for that is, or the answer to that would be that the platelet-rich plasma is our own growth factors in our platelet-rich plasma. So not that anybody would ever have an allergic reaction to the likes of Bellaterra, Restylane or to Profilo. It's just that some people like to use their own platelet-rich plasma, but it's full of growth factors, which is part of PRP is the future. It's part and parcel of regenerative medicine, used widely in hospitals and in sports clinics. And the growth factors in PRP is not something that you can manufacture in any factory. So if we're part and parcel of the future, we want to be part of the future. And whilst the likes of Restylane and Bellaterra and Profilo are their places in the market, we want to be part of the future as well. So Blonde will need to return again in 4 weeks' time and have it redone again, and then she'll start to see the benefits of regenerative platelet-rich plasma and growth factors. And then after that, then it's once every 6 months to maintain that lovely glow.